Well, this segment is brought to you by Hospice Care of the West, and they brought us a very important guest with us today, and that's Patty Barnett Moton, and you're with the Vice President of Outreach and Advocacy for the Orange County chapter of the Alzheimer's Association, and you're a familiar face to Channel 6. Thanks for joining us today.
Thank you for having me, Paul. It's great to be back in the village.
Yeah, you've been on the show with Marsha Wilson on Social Services Corner a couple times.
Yes, frequently.
Yeah.
It's really great to be able to share the message of the Alzheimer's Association and the care and support we can provide.
Right.
But today I get to be talking about my experience as a family member of a patient of Hospice Care of the West.
Now, your mother-in-law, I believe, just was in hospice. Tell us about that experience.
She was 96 years old and had been suffering from Alzheimer's disease for a number of years. And she had a fall, unfortunately, that caused her to be hospitalized. And then as we were planning her care, the doctors all said hospice was probably the best option for her. So that's what we did. She was discharged from the hospital and she went to the Covington Skilled Nursing Facility with Hospice Care of the West, kind of managing and orchestrating her care.
Now, when you decide to enroll her in hospice, was that mostly a decision made by the doctor, or is that a decision made by the family, or kind of both?
It's an interesting question. It was a surprise for us that the doctors really thought hospice was the option at the time. Although looking back at it and understanding what I know about hospice care from my professional background, it really was the right option. So it became a whole total family decision, and it really worked out well for her.
And then at that point, then you have to choose the right hospice provider, and your family obviously put that together as well, and you chose Hospice Care of the West. Why is that?
Well, I was really fortunate, Paul. I had worked in hospice care as a professional. I'm certified as an end-of-life nursing instructor, and the executive director, Debbie Robeson of Hospice Care of the West, is a colleague and has become a friend over the years. And as I was just talking with her and getting some professional advice about my mother-in-law's care, she mentioned that she'd be honored to be trusted with my mother-in-law's care, and that really spoke to my heart.
Right.
So that was a factor. Also, the fact that not every hospice has a vigil program where they can ensure that should the family not be able to be with the loved one all through the night, they have specially trained staff and volunteers who will be there all through the night just to provide comfort and companionship.
Right. How long does hospice usually last in your experience?
Well, unfortunately, most families don't initiate and engage hospice care until about the last 2 to 3 weeks of life. And in our case, it was really just 2 weeks of care. You can use hospice and use it as part of the entitlement for 6 months, for a year, if the patient continues to qualify. And my feeling is, wow, we should really be using hospice more than we currently are. It was a tremendous, tremendous benefit in planning her care.
And when someone becomes part of hospice, what kind of care do they get on a daily basis? And is that in your home? Is it in someone else's home? Is it in the hospital?
Really excellent question, Paul. Hospice really is brought to wherever the patient's home happens to be. So it might be in a private home. In our case, it was in a skilled nursing facility for short-term kind of care.
Right.
So it depends upon what the family situation is. But the hospice team, especially here in Orange County, comes to the patient's home, provides the care on an intermittent basis. So there's a nurse case manager, there's a social worker to help sort out family issues and plan things. In our case, the social worker was really important because I don't know about you, but we had some family dynamics.
Yep, there always are.
We needed someone to help smooth out sort of the stressed edges of family communication between some of the siblings, and that social worker was marvelous. We had just a wonderful experience with the spiritual care. The chaplain, Chaplain Dave from Hospice Care of the West, understood that our family happens to be Catholic, and we wanted a priest to come right away as soon as she got out of the hospital, but priests are busy. And Chaplain Dave called over to our parish, and do you know, within 30 minutes, whatever Chaplain Dave said, motivated and resonated with our pastor because the Monsignor showed up in 30 minutes.
Nice.
It was wonderful.
Yeah.
So they address the spiritual aspects, the social work, family dynamics aspects.
Right.
There's really strong clinical medical support. So we plan care that is really going to anticipate what the patient's needs might be, not wait for a crisis. It's all set up so that if this happens, we're prepared and we're ready to go.
Right.
The hospice team prepared the staff at the Covington on what to expect and how to manage the care intermittently. It was lovely.
And like you just said, you know, we're all busy, and unfortunately, even though someone may be passing, we also have to go to work. We all still have to get our kids to school, things like that. So it's nice to know that someone is taking good care of your family member until you can get there and be, you know, a part of their day. So that's why it's nice to have an organization like Hospice Care of the West, you know, help you out. And it sounds like that's the experience you're having.
It's exactly the experience we had. I did take some time off from work. Thanks to all of our electronic communications, I was in touch with my iPad, and we actually had some really lovely moments where I was able to take photographs of my mother-in-law as she was resting comfortably, and some of the lovely interactions that happened with staff.
Yeah.
So now our family has a really lovely record of the wonderful care she received.
Right, and that does make a huge difference, that you know that your loved one is, you know, comfortable. And that's the most important thing, is that they're comfortable, you know, as they pass, and that their family gets to spend that time with them.
Yes, comfort, certainly no pain, relief from anxiety. One of the things that we now find so dear is they even sent a hairdresser to trim her hair and make sure she looked adorable. And my brother-in-law was sitting there and he badly needed a haircut, so the hairdresser did his hair too, right at bedside. We were concerned she might be a little bit anxious, and they said, "Do you have a family pet?" And they suggested that we bring our little dog over so that she could pet the dog and feel very comfortable and familiar, and it worked beautifully. What a great
experience for you and your family at that time. Hospice Care of the West also provides service to veterans as well, that you know about.
They do. Coming from a military family, I'm really a champion and an advocate for veterans, especially World War II era veterans and Korean War veterans, getting all of their entitlements. And so it's really wonderful when an organization like Hospice Care of the West really steps up and looks into all of the ways they can help our veterans of military service.
Great. Well, it sounds like a terrific experience, and obviously she had a great experience with Hospice Care of the West and her family, and it's a very difficult time in people's lives, so it's nice to have that professional background and that support to get you through those hurdles. And like you said, it's stress too, because family members will react differently during these times. So it's nice to have someone there that can kind of moderate and get you to the next step, instead of having another family member make that decision. You have a professional doing that can get people on the right track.
Right.
Well, it sounds like a good experience for you. We thank you for joining us today on
My
the program.
pleasure.
And we're going to learn more about the Alzheimer's Association when you come on with Marcia in the next coming days as well.
Great. Thank you so much, Paul.
Well, be sure and give them a call. Hospice Care of the West, they have an 800 number. It's 405-1159. That's 1-800-405-1159. We'll be back with more of the Channel 6 News Hour right after this.